Hi, everybody. With me today is Sharon Marsh. Sharon is a veterinarian in East Texas, and we are really excited to have her with us today to chat about the veterinarian of record issue. Hi, Dr. Marsh. Nice to
Hi.
see you. Thanks for joining us today. Tell us a little bit about you.
My name is Dr. Sharon Marsh. I live in East Texas. I'm a high volume spay neuter veterinarian. I have been doing that exclusively since 2013. I own a 2-clinic practice currently, and we're strictly mobile, and we drive around all over East Texas, hours away. To offer our services to the community. I also just recently started a nonprofit that gives spay neuter assistance and vaccine assistance to the communities that we serve.
Well, thank you so much for doing what you do. We really appreciate it and need more of that. You are also a veterinarian of record for a couple of organizations. Can you share a little bit of what you do as a veterinarian of record and how that relationship started?
I early in my career, I should say a lot because it was a lot of shelters reached out to me, not only to use my services because I was mobile and they didn't have surgery suites. They would invite me to come to their shelters to do their spay neuter surgeries. And during that process, I would check on animals they had there. Unfortunately, perform euthanasias if needed, if they didn't have a certified technician there. Um, and then through that process, through those relationships, they needed to order some things that to have on staff to follow the protocols that I would give them. So whether it be antibiotics or minor pain medication or things of that nature, even having some dressings or anything like that, they needed a vet on record for just to even place a simple order. So they would ask me to do that, and I agreed because I had relationships with them. So I was already there doing their spay and neuters, had done site visits and things like that.
So you brought up a couple of things that I'd like to unpack. First of all,
Okay.
you mentioned the word relationship.
Right.
So what did you do to build that relationship to make it comfortable for you to want to do this?
Well, I was already at those locations. I wouldn't feel comfortable because there wouldn't be a relationship being a vet of record at a shelter that I have never seen or wouldn't routinely go to. I'm the vet of record for 3 different clinics or 3 different shelters right now. And of those, I probably visit one of them. I used to have a really involved relationship with them. It was the first one that asked me. It's a municipal shelter. It's a pretty large city. I'm still their vet of record, but I don't go there as often. But the other 2, I do go regularly. So I do their inspections. I do their spay and neuters. I'm always there. So again, it just comes to me being on site, me knowing what they're doing, um, me knowing that they're following the protocols that I'm writing for them, because that was another, issue to have protocols in place. So you can't just let them or let shelters purchase medications without having some sort of guidance, because then that trust is broken, in a sense, because then they're ordering things that may not be related to protocols you have. And um you want to make sure that they're following your guidance in order to fulfill that relationship appropriately.
So you had said that there are 2 that you visit and that one that you don't visit as often. The one that you don't visit as often, are you still comfortable with that relationship, or do you really feel that being on site and seeing what's happening is the key?
I think that relationship is pretty well established. And I do go there. It's just not as often. So I may go there once a year. as opposed to, because we used to do the surgeries on site there, and then they moved to another facility that really couldn't like accommodate our spay and neuter trailer. So we had to basically just go to another location. So that's why I'm not there as often. But it's still, I've had such a long-standing relationship with them that the trust is there. So I trust them to follow, my guidance, and without me necessarily being present weekly or monthly or whatever the case may be. The other clinics or shelters that I and the vet a record for, I do see them, like I said, routinely, because I still go to their sites to do spay neuter, or they bring animals to me to even other locations. And so I see them, I see their faces, I'm more comfortable, continuing those relationships as well. But the other ones, the one that I don't go to as often, they still reach out to me with questions that they may have. So again, the trust is still there because I know they're not doing things, essentially like behind my back, to pretend, or not pretend, that's not the right word I'm trying to say. What is the word I'm trying to think of? But like, they're not acting like a veterinarian, right? They're not doing veterinary practices behind my back or anything like that. So they are asking me. I think I would be more concerned if they were not asking those questions, like
Right.
asking how to treat things or how to look at things or having me look at things. I would be more concerned, but that relationship is well established. I've been working with them for quite some time.
How do you deal with the veterinary client patient relationship issue? And I don't know what that is legally in your community, but I know that that comes up a lot as a concern for some veterinarians considering this.
Right. My mentality with shelter medicine has always been to approach it like herd medicine. So as long as there's established protocols on, okay, if you see a dog that may have mange, these are the steps, or hair loss, let's say, these are the steps that you will go to diagnose it. Not diagnose, because again, they can't diagnose things, right? Because they're not veterinarian, but they can go through the steps to help gather evidence that would follow that protocol to treat it. So if they see, X, Y, and Z, they would look at the chart and, that associated with those signs, and then be able to give the appropriate treatment. So to follow that example, they would do a skin scraping, which they're allowed to do, see if they see mange or mites, they can give them like a Bravecto, or for example, and they could have that on hand to give to that patient. As long as they're following that protocol. Now, if it's negative, then they would probably have to reach out to me to say, hey, we have this like chronic case of dermatitis. We can't, the skin scrapes were negative. What should we do? That, as long as that kind of relationship, if it doesn't follow the protocols of specifically what, they should be doing and seeing, then as long as they're reaching out to a veterinarian, it's perfectly fine. But again, it's that herd health. It's no different than, a pasture full of cattle, farmer sees, a limping cow, they follow this protocol that's, that rules out things, and they can
Yeah.
treat the cow how based on that protocol that a veterinarian has given them. And if it doesn't work, then they should reach out to a veterinarian and make sure that they're, because it's outside of the protocol. So you do have to trust that they are doing that and following those guidelines.
So how do you deal with it if the trust is broken? So I've got to assume that there's been a case by case here and there where there's either been broken trust or you've found something, and did the relationship just end, or was there a dialogue, or how did you work through that?
Yeah, there was, before I became the vet of record for one particular city shelter, um, when I was walking through their clinic, I did see like some things like they had, and it's like, it's a gray area, right? Because they can have heartworm tests, they can have parvo tests, but yet they're not allowed to diagnose anything. So it's kind of like, how are you having these things if you're not allowed to diagnose anything? So it's like this weird gray. So whenever I took over Vet of Record, I was just very clear on like, if you have a positive test, you have to send it to me. I have to see the test so I can be the one that diagnoses it. And then you can do whatever steps are in that protocol to, take care of that patient. Um, so far I've had good compliance, but I don't know what they were doing with the old vet record. I really don't
Mhm.
know. So it does raise, a little red flag and be, to stay on top of it. But again, to to point out one of the issues, there has to be communication, right? You have to be able to communicate with them regularly. You don't want to have a hard time getting a hold of them. They have my cell phone number, so they usually just text me things that they need. But if they weren't communicating with me, I would be suspicious. And I haven't had anything happen yet. As
Good.
far as when I go to on site, they haven't had meds that weren't part of any protocols I wrote. They haven't had anything, that was concerning to me. So I've been fortunate and it hasn't happened. But again, I don't know what they were doing prior
Yeah.
to me
But
getting there. I think there was a lack of communication with their old vet, and so that's why um he lives like a couple hours away. So I doubt he was ever there. I don't know how he became the vet of record or anything like that, but I think there was probably not the same level of communication. So they may have been taking things into their own hands and um not, having that trust and communication there. But with me, I just you have to stay on top of it, basically.
yeah, it sounds like you have done a great job of pre-setting your expectations,
Right.
creating the protocols, and creating a relationship and a communication stream to ensure that there's no problems and it's clear and everybody knows what's expected of you.
Right.
And may I ask, and I'm not asking for specifics on payment, but how did you set up a payment structure so that you can get paid for this job? And again, I'm not asking for how much,
Yeah,
I'm just
no.
asking for how you set it up. So if another veterinarian out there wants to do something like this, obviously you need to get paid for your services. How did you set that up?
Well, one in particular, the city shelter I was just mentioning, the city manager, approached me, asked me to be the vet of record, and he kind of drafted with their lawyer a contract that said, we will pay you up to X amount of dollars for the year for your services. Just submit an invoice to us based on, if you come out and do a site visit, if you charge for that, as long as it was within their budget, um, it was fine with them. So I would just submit invoices now, to be honest. I haven't done that. So I do pretty much offer my services for free to this shelter. I know that the option is there for me to submit
That's
invoices.
very
Um,
thoughtful of you, but
yes,
most
I know.
veterinarians are expecting to, and rightfully so, should be
I
paid for
know.
their
Be
work.
paid,
So
yes. And the option is there. So it's not like they haven't given me the option. They have offered to pay me when I do my site visits. Um, the other and I just choose not to, but I can. And if I ever have had to actually use physical resources to help them, if I've ever had to order anything, like special order anything for them, or go out there myself to look at a case or something like that. And I have. It's not that I haven't at all. Um, but most of the time, just to be the vet of record, just to have my name on something, I haven't. But at another vet of record location that I do get paid. I get I do clinics for them. So I do spay neuter events for them. So I get paid that way. I don't necessarily get paid specifically to be the vet on record, but I am their veterinarian that is in charge of their spay and neuter program. So I get paid kind of through that way, if that makes any sense. I don't
Yeah.
get paid specifically to be the vet on record. And then the other location that I've been longstanding with, that I was mentioning, I only see them, one or a couple of times a year now. It's the same thing. They have a city contract. It's a city shelter. They have a contract that says, and in addition to my spay and neuter services, which they pay me for, I can submit invoices, based on the services I provide for them. So if I go do an inspection for them or something like that, I may charge them, but it's a subjective, pricing. It just depends on how long I'm there. Um, any
So you
cases
do
that I
you
may
do it
see.
based on services provided.
Right, right. And
Got
I
it.
don't have like a set fee that I charge them monthly to be the vet on record. It's mostly if it's taking up any resources, then I will bill them for that. But it's usually
Okay.
only if resources are involved. I don't bill them regularly just to be the vet on record, if that makes any sense.
Sure. So is there anything else that you would share, any nuggets of wisdom that you would share to a veterinarian considering being a vet of record in their community?
Yeah, I would make sure that it's an established shelter or sometimes a rescue. Rescues are a little bit trickier in my book, just because of, there's more of a stigma, I guess, around rescues, that they kind of do their own thing, if you will. So make sure that they're established, they have protocols in place, they respect that relationship, and respect your position as a veterinarian. Make sure that there's no red flags, and if there are, just call them out and say, hey, we need to address that you are doing this and I'm not necessarily comfortable with that. So just don't be afraid to voice your opinion or your concerns about something if they're doing it. Again, it's your license.
Right.
It's your livelihood on the line. So you have to be able to be comfortable with that relationship. And if they're not making you comfortable, then address it. I'm not saying you have to walk away from it, only if, they aren't working with you, but do give them a good direct form of communication with you. So cell phone number or personal email, just so they can contact you directly and don't necessarily have to go through a third party, because that way you can be more comfortable knowing that you can talk to the executive director or talk to the shelter manager if you have any concerns, instead of having to go through, different channels to get a hold of them. That would be my biggest thing, is the communication and making sure that they're established and that they have your protocols, and it's a two-way conversation about protocols too. So you have to make sure that it's something that they're comfortable with, that they can handle. Because if you're going to a shelter that has no veterinary technicians, which that one that I keep referencing does not, it's just the shelter manager. If she wasn't comfortable doing some of the steps in the protocol, then we would have, that would be an issue. So just make sure that they're comfortable with it and that they are, again, in constant communication if they have any concerns.
Awesome. Well, I thank you so much for your time today and for your communication about this, for being a veterinarian of record, and for you sharing what has worked for you. So we really, really appreciate you today. If anybody has any questions on what you do and how you do it, would you be willing to give an email so that they can contact you?
Sure, sure. Yeah, it's pretty, you can have my personal email to share. Do you want me to say it here? I'm sorry.
Yes, yes.
Okay, okay. It's SHRN Marsh 922 at Gmail. So SHRNMARSH922 @gmail. So that's my personal email, and I'm happy to answer any questions. So pretty passionate about what I do, so I'm readily available to answer any questions.
Dr. Marsh, thank you for being who you are and for helping the animal welfare space in
Thank
what
you.
you do. So we appreciate you very much.
Thank you.